Hello, it's Dr. Gay from First Lake MRI, and these are a few examples of multiple sclerosis. So this is a middle-aged female, and as we go down towards the bottom and come up towards the top, we see one of the lower cuts. This is the patient's brainstem, the pons, and this is towards the front. On the right side, we see a little white matter lesion there. When we see small lesions in the pons or medulla, part of the brainstem, very typical for multiple sclerosis. So that is a sign. Here's another one right there, very tiny little white matter lesion possibly on the left side. And often we'll see little peripheral lesions running around the rim. This could be one right there. So look very closely at the pons. Also the brachium pontis over here, or middle cerebral peduncles, will also be affected. And if you see a lesion in the brainstem or cerebral peduncles, that can be a classic finding of MS. Now we're going on up to the midbrain. Looks good. As we go up higher here, we see a few little small scattered specks in the white matter. Here's one in the left frontal lobe, and here's one over here. And as we go on up, we see more scattered lesions, and there's one that is very helpful in the diagnosis over here on the right. So this is the right lateral ventricle, and there's a white matter lesion here that's perpendicular to the right lateral ventricle, and this is what we call a Dawson's finger. And this is a multiple sclerosis oriented along the course of a vein, and when it's perpendicular like this is a really common appearance, and you could say almost pathognomonic for multiple sclerosis. So in this patient, we can have a high degree of confidence that these aren't related to migraine headaches or collagen vascular disease or some other thing. This is very likely related to MS, given the brainstem lesions and then this Dawson finger here. Now we're going to go on to another patient. Now this other patient, this is down in the brainstem. We see a little pontine lesion here. We also see towards the back here, this is the brachium pontis or middle cerebellar peduncle back here. We see a little lesion here. So this is, again, very classic for multiple sclerosis. There's one right there. As we go on up, we see multiple other lesions here. And we see one here in the left thalamus. There's a posterior white matter here, a little bit of atrophy with chronic MS. We're also looking at atrophy, so a very severe diffuse white matter disease. And a little horizontal one here, looks like a Dawson's finger. So this looks like more of a advanced MS, and with this horizontal lesion here and other lesions in clinical history, this is consistent with multiple sclerosis. Sometimes you can get lesions like this that look like tumors or infarctions, and we call this tumefactive MS when you see a big area that's rounded. Now, multiple sclerosis loves the corpus callosum. So corpus callosum goes around the ventricles. Here's the anterior portion of it right here. And back here we have the posterior portion. And so we look really carefully in patients we suspect that may have MS at the corpus callosum. And in this patient we do see something down low in the posterior aspect. We see right here this bright or hyperintense flare signal. So this is a classic look. It's affecting the posterior corpus callosum. And we also look around the ventricles to see is there anything hugging the ventricles right in this area, those Dawson's fingers, and we don't see anything else over here. But again, that signal back here, really classic for MS. Now here's another patient. We're going to start down low here in the cord, coming on up, medulla. We're going to come up into the pons. Look at those cerebellar peduncles, looking pretty good. And there's a lesion right there in the midbrain on the right side. A small lesion right there, classic for MS. Now we're going to keep on going up to see if there's anything else. We have a lesion here, and we're going to keep on going up, and here's another one. So this is that anterior corpus callosum affected, and this is a rounded area. It looks like a tumefactive MS plaque. Looks almost like a tumor. And the posterior corpus callosum back here looks good. So another case of MS affecting the anterior corpus callosum, and down here in the midbrain on the right hand side, that little lesion right there. And this is a patient who has known MS, little horizontal lesion here. We see this hyperintense signal surrounding the ventricles, the pericallosal or periventricular white matter. So this patient has MS that's hugging the ventricles here. This patient also has cortical lesions. Here's a left cortical lesion, right side. Often, or not often, but on occasion, rarely, it can affect the subcortical white matter and sometimes go into the deep layers of the cortex, but this patient has a few little scattered lesions on both sides. Pretty rare to see it like this. Here's one back here. Typically we think of MS as a deep process that involves a periventricular white matter, but again, it can cause cortical lesions like this. We're going to come on down, see if there's anything else. Down to the midbrain, brainstem. Looks good. Here's another patient with numerous scattered white matter lesions, all these little white specks throughout the white matter. And this is a non-specific appearance. I don't see any of the deep periventricular lesions, no Dawson's fingers. There's nothing in the brainstem, but clinically they had a diagnosis of MS. Here we also see in the brainstem down there, but this again is non-specific, so we'd have other things in the differential. And finally we have this patient who has a lesion in the brainstem, a lesion with fairly well-defined margins, some heterogeneous signal, edema surrounding it, and also another lesion here in the temporal white matter. And this patient was given a diagnosis of multiple sclerosis. Just clinically, the surgeon or the neurologist thought they had multiple sclerosis clinically, but this could be a brainstem glioma, could look identical, or tumefactive MS could look just like this. So as a radiologist, we would say this is nonspecific. We see a lesion here in the brainstem that looks like a tumor, but this could be active tumefactive MS plaque. They're going to look just like a tumor or infectious etiology. And so this is again nonspecific, but given the clinical history and neurologist, we thought this was probably a manifestation of MS that we call tumefactive MS because it looks just like a tumor. Here it is in a sagittal view here. And that's it. So several different presentations of multiple sclerosis, and thank you very much.